Welcome to the ClearTriage video training series. In this video, we'd like to take a few minutes to discuss how to best use the triage assessment questions, otherwise known as the triage checklist. The assessment questions included in the ClearTriage protocols are designed to be used as an adjunct to your nursing judgment, clinical training, and critical thinking. They are a checklist. They are not designed to be a script that is read to the caller word for word. It is the combination of the nurse's critical thinking and the ClearTriage decision support tool that will lead to optimal outcomes for patients. Let's talk about how this works. When you're in the Triage tab, you'll see the triage assessment questions for that protocol. For this example, we're using an account with the detailed documentation setting turned on, which is why there are yes/no buttons instead of checkboxes next to the triage questions. Questions are grouped by disposition and listed in descending acuity order. To ensure care is not delayed for patients experiencing urgent or emergent situations, you should rule out questions in the order in which they are presented, top to bottom. You should rule out each question in a disposition before moving to the next set of questions in the following disposition. However, you don't need to ask every question word for word if the initial assessment, conversation, or medical record has already provided the answer. In this example, the patient is reporting abdominal pain for the last 8 hours. You don't need to ask the age over 60 question because they are in their 40s, and you don't need to reassess pain as that was discussed during your initial assessment. The patient rated their pain 5 out of 10, which is moderate, not severe pain. You only need to rule out the questions you haven't already ruled out. You'll ask about vomiting and his bowel movements. Then you'll rule out difficulty urinating and pain in the scrotum or testicle. You will continue until you get to the first yes, which in this example is mild to moderate pain that has been constant for over 2 hours. An important exception to ruling out each question from top to bottom is that within a disposition, you can mark any question as yes without first ruling out the questions above in that disposition. This works because all of the questions in that disposition will result in the same outcome, so selecting any one question as yes in a disposition has the same outcome as selecting any other question within that same disposition. A related piece of advice is that you do not have to rule out the questions within any single disposition sequentially. It is often most efficient to do so, but it is not required that you triage in that order. You just need to rule out all of the questions in a disposition before moving on to the next group of questions within the following disposition. Typically, you should stop the triage process when you've selected the first positive question and all questions in higher dispositions have been ruled out. But if you are using the after-hours protocols, ClearTriage has a feature called Targeted Care Advice. This means the education available to you in the Plan tab is related to the triage question or questions you have marked as yes. So if you are using the after-hours protocols, you occasionally may need to select an additional positive triage question or two in order to display all of the relevant care advice topics to educate the patient on. This concludes the Using the Triage Checklist training video. Thanks for watching.